Imagine getting filler injections with almost no guesswork, minimal risk of hitting a blood vessel, absolute precision. Sounds like the future, right? Well, that future is happening now thanks to ultrasound technology. Today, we're diving into how ultrasound is changing the game for dermal fillers, making injections more safe, more accurate, and honestly, kind of mind-blowing. Welcome back to Anti-Aging Insights, and today we are talking about ultrasound for filler treatments. Why is this such a hot topic right now? Well, as you may know, there are filler complications that can occur. Fortunately, they are very rare, but these things can include vascular occlusions when the filler is injected into a vessel. You can get things such as bruising, you can get some lumps, you can get migration, and quite frankly, it's time for a smarter approach. So what we are going to discover today is how ultrasound works with injectables, why it's a game changer for safety, and what this means for the future of aesthetic medicine. So in the past, injecting fillers has always been a little bit of a feel and experience type of technique. Even in the hands of a very skilled injector, there's always some uncertainty because you can't see exactly where that needle is going and ultimately where the filler is going. The biggest risks are vascular occlusion, which is blocking of a blood vessel. This is not good news by any stretch of the imagination. You can also get some asymmetry, you can get migration of filler, you can also get bruising or bleeding. So these complications, particularly in the case of the vascular occlusion, then requires some dissolving of the fillers. And when you inject the medicine to dissolve the filler, there's always a little bit of guesswork as to where that should go as well. More people are getting filler now than ever, so we need better tools to minimize risks. And ultrasound allows injectors to see beneath the skin in real time. Instead of just relying on anatomy knowledge and feel, injectors can actually visualize the blood vessels and avoid them. You can place the filler exactly where you want it, down to the millimeter. You can also check previous filler to see if it's integrated or if it's migrated. You can think of it almost like a GPS for filler injections. No more blind spots. Increasingly, this is being used in the more higher risk areas of filler treatments as well. These would include tear troughs, lips, nasolabial folds, particularly the nose, temples, glabella. These are all some of the higher risk regions, particularly those regions in the center of the face. Aesthetic medicine is becoming more like medical imaging, combining science and beauty. So why does this matter for you? If you're a patient, going to an injector that uses an ultrasound means fewer risks, better precision, less bruising, swelling, and less worry about complications. Now, nothing will ever make it 100% risk-free, but ultrasound is a way to significantly reduce that risk. As well, if you ever have to reverse a filler treatment, such as dissolving it, then the ultrasound can help to guide where that needle needs to go as well. If you are a provider, then this is the future. More accurate treatments means better patient satisfaction and the ability to handle complications with confidence. I think that this will likely become the standard over the next couple of years, and it is a skill to learn, so early adopters will have an edge. How does this actually work? Well, what you do is you use ultrasound gel, you put it on the ultrasound probe. There are a number of different probes these days. Some of them are quite large machine stationary devices, and then there are also handheld devices, which is what I use in the clinic. You simply place this probe over the area of the face where you want to look for the blood vessels, and then you can see the different layers in the tissue. You can see the skin, you can see subcutaneous tissue, you can see fat, you can see muscle, you can see blood vessels. And you can change the settings on the ultrasound, such as a Doppler mode, which then allows you to identify blood flow through the vessels. And this is the key. Now you can see where the blood vessels are. You can see if they are closer to the surface of the skin, if they're a little bit deeper, and you can actually measure where they are and how deep they are. And so you make a mental mind map of where these blood vessels are. If you want to, you can actually draw these blood vessels on the face of the patient as well. Ultimately, it allows you to visualize where the vessels are and where you do not want to put your needle. Again, making this safer for everyone involved. So, is ultrasound the future of injectables? 100% yes. Precision is everything in aesthetics, and this is taking us to a new level of safety and accuracy. If you're getting fillers, don't be afraid to ask your provider if they use ultrasound. It's becoming more common, although admittedly it's still relatively uncommon, but more and more injectors are seeing the value in this. And if you love staying ahead of the curve with anti-aging, then make sure to subscribe to this podcast and let me know your thoughts on this. What do you think? Would you feel more confident getting your filler if your injector used an ultrasound? And if you are the injector, do you feel more confident using an ultrasound before you do an injection on a patient? Reach out to me, Dr. Teri Fisher, on Instagram or any other social media channel, and I look forward to speaking with you again really soon. Take care.